Hello everyone, and welcome back to Seasoned and Bold channel. Today, we're diving into a topic that affects nearly half of all adults over 30, yet often goes unnoticed until it's too late. Hyperlipidemia, more commonly known as high cholesterol or high blood fat. It's a silent threat, and by the end of this video, you'll understand why it's so dangerous and, more importantly, what you can do about it. In most of developed countries, almost 50% of people over 30 are diagnosed with hyperlipidemia. This number is even higher in men, reaching up to 60%, while for women, it's around 37% in average. So if you're in your 30s or older, this information is particularly crucial for you. What exactly is hyperlipidemia? Simply put, it means there's an excessive amount of fat and cholesterol floating in your blood. The problem isn't the condition itself causing immediate issues, but rather the domino effect it triggers. The dangers of high cholesterol, a silent killer. Imagine your blood vessels as intricate highways for your red blood cells. When you have too much fat in your blood, these fat cells start to block these microscopic pathways, preventing essential red blood cells from reaching their destination. What happens then? The cells below the blockage are deprived of oxygen, a state called hypoxia, and can even undergo necrosis, meaning they die. This isn't just about cholesterol. Hyperlipidemia rarely exists alone. It's often found alongside other chronic conditions like hypertension, high blood pressure, and diabetes, forming a dangerous triad that significantly increases your risk for severe health problems. In fact, studies show that cells in a hypoxic, acidic, and hypothermic state are more susceptible to becoming cancerous. One of the most terrifying consequences we're seeing today is the calcification of arteries. In the past, this hardening and whitening of major arteries like the aorta were typically seen only in people in their 80s or 90s. But now, it's increasingly observed in individuals as young as their 50s and 60s. This is essentially plaque and inflammation building up inside the artery walls, becoming hard like stone. And it gets even scarier. If the aorta, your body's largest artery, can't withstand the high blood pressure, it can tear, leading to a condition called aortic dissection. This is where the inner layers of the aortic wall split, causing blood to flow between the layers. It's an emergency that often presents with severe chest pain and a sudden drop in blood pressure. If diagnosed, immediate transfer to a specialized hospital for complex surgery is required. Unfortunately, half of these patients may die during transport or while awaiting surgery, and the number of surgeons specializing in this critical procedure is dwindling. This is why we absolutely cannot take the accumulation of plaque and calcification in our blood vessels lightly. The dietary revolution: what to eat and what to avoid. So, how do we fight back? The good news is, a significant part of the solution lies in our diet. It's about making conscious food choices that support healthy blood vessels. First, let's talk about fats. We need to focus on good fats, specifically plant-based fats rich in omega-3. Our top recommendations are whole Perilla seeds and flaxseeds, as they have the highest omega-3 content among plant oils. Perilla oil. If you use Perilla oil, make sure it's fresh, pressed within a month to ensure maximum antioxidant benefits and prevent oxidation. Whole Perilla seeds, a fantastic way to incorporate thymus to wash them thoroughly and add them to your brown rice. Not only do you get the nutritional benefits, but the texture also encourages you to chew your food slowly and thoroughly, which is vital for digestion. Beyond Perilla seeds, other beneficial foods include nuts. Think walnuts, peanuts, and cashews, which provide good fats. Berries. Strawberries, cranberries, blueberries, and blackberries are packed with antioxidants. Fermented foods such as yogurt, kefir, kimchi, miso, kombucha, sourdough, and aged cheese. Ginkgo leaf extract. Known for improving blood circulation and preventing blood clots, similar to aspirin but with fewer side effects related to stomach irritation or wound healing. Now let's talk about what to avoid, because these choices are just as crucial. Animal fats. Minimize these as much as possible. When choosing meat, opt for leaner cuts. For instance, instead of prime beef grades that are loaded with fat for flavor, choose third or second grade cuts. For pork, skip the fatty pork belly and go for lean cuts from leg, preparing them by boiling or steaming rather than grilling at high temperatures. High-temperature grilling or direct flame cooking can create carcinogens. Trans fats. These are the absolute worst. Trans fats are hydrogenated vegetable oils like margarine and shortening. They are designed to be solid at room temperature, and unfortunately, they behave similarly inside your body, making them worse for your blood vessels than animal fats. You'll often find these in processed snacks, and most notoriously, in fried foods. Excess calories. Any calories your body doesn't need are converted into fat and stored, leading to obesity and visceral fat, which are direct causes of hyperlipidemia. Unhealthy dining culture. Try to reduce frequent heavy meals, especially those involving grilled fatty meats and excessive alcohol. If you have influence, suggest healthier options or alternative social gatherings. Lifestyle transformations. Beyond the plate diet is fundamental, but it's only one piece of the puzzle. Two other critical lifestyle changes can dramatically impact your fight against hyperlipidemia. First, how you eat is just as important as what you eat. Eat slowly. This sounds simple, but it's incredibly effective. We even recommend using a 30-minute hourglass at the dinner table. Chewing your food thoroughly allows more saliva containing amylase to mix with your food, aiding digestion, reducing the burden on your stomach and pancreas, and improving nutrient absorption. The reverse eating method. Start your meal by consuming plenty of vegetables and fruits first. Aim for at least 50% of your meal to be greens. Then, follow with smaller portions of brown rice and other side dishes. When making salads, use sour dressings instead of mayonnaise-based ones, which are high in fat. This approach helps you fill up on fiber and nutrients before you consume heavier carbohydrates and proteins, reducing overall calorie intake. Second, exercise is not an option, it's a necessity. The science. When you exercise, your body uses up energy. It first burns glucose, sugar, then stored glycogen from your liver, and finally it starts tapping into your stored fat, especially the dangerous visceral fat around your abdomen. Exercise also raises your body temperature and increases blood flow and heart rate, directly combating the very conditions that lead to hyperlipidemia. Broader benefits. Regular exercise prevents obesity, improves blood circulation, helps manage blood pressure and blood sugar, and even prevents cancer by resolving the hypoxic, hypothermic, and acidic states that cancer cells thrive in. What kind of exercise? While strength training is good for building muscle, aerobic exercise is crucial for burning energy and fat. For younger individuals, consider group sports, hiking or cycling. For older adults or those with joint concerns, brisk walking, fast enough to sweat and become slightly breathless, is excellent. Stair climbing is also highly recommended, Aim for about 10 floors up and then take the elevator down to protect your knees. Moderate intensity is key. You should feel your breath quicken and your body temperature rise. Finally, while medications can temporarily lower cholesterol levels, they are not a cure. True healing comes from consistent lifestyle changes. Incorporate healthy supplements like plant-based omegas and ginkgo leaf extract if needed, but always prioritize diet and exercise. To summarize, hyperlipidemia is a powerful warning sign from your body that your current lifestyle may be putting you at risk for severe, life-threatening conditions. But it's also an opportunity to take control. By making informed choices about what you eat, how you eat, and by making exercise a non-negotiable part of your routine, you can prevent these diseases and safeguard your health. Your blood vessels are your lifeblood. Let's keep them clear and flowing. Thank you so much for watching. If you found this information helpful, please like this video, subscribe to our channel, and share it with someone you care about. See you next time.